The motivation for the STARTAR trial was to help men who have a PSA recurrence after radical prostatectomy, but because of their high-risk features, have a very high risk of disease progression despite salvage radiation and hormonal therapy. And we know certain high-risk features exist for these men, such as a high tumor Gleason score, high PSA, lymph node metastases, and tumor staging characteristics like seminal vesicle invasion. We've previously published on multimodality therapies for these patients, such as the multimodality study with docetaxel and salvage radiation, and the STREAM study, which was published last year on enzalutamide and salvage radiation. The STARTAR trial builds on those prior studies in this salvage radiation setting. And STARTAR was designed as an investigator-initiated multi-center study that we conducted within the Department of Defense Prostate Cancer Clinical Trials Consortium, where we investigated the efficacy and safety of apalutamide with standard androgen deprivation therapy for about 8 months, which was layered on top of standard salvage radiation to the prostate bed and pelvis, as well as adjuvant docetaxel for up to 6 cycles. So the ADT apalutamide was given at the same time as the radiation and the docetaxel. And after that period of time, men had their treatment stopped. This very intensive treatment ended after about 8 months, and they are followed now for a primary endpoint of 3-year progression-free survival. And so in this poster, we're presenting really the interim analysis to report on the safety, the feasibility, really a trial in progress, and the PSA endpoints, really with about 14 months of follow-up. STARTAR was conducted very successfully. We have enrolled 39 patients across several centers. That includes Duke University, Cornell, University of Nebraska, and Wake Forest Baptist Medical Center. Within this consortium, these patients were enrolled, and all patients have now completed their therapy. And with a median of 14 months, we've had 0 relapses. So it's still very early days, but so far good news. Patients have tolerated this well, and all these patients who had been at high risk of relapse are currently with a 0 PSA and without further relapse, and they're off therapy. Many men have experienced testosterone recovery, about 40%, but still very early days. This is a work in progress. The trial was as expected, no unexpected toxicities. We did have some patients develop some neutropenia from the docetaxel, but no unexpected adverse events. With apalutamide, some men did experience hot flashes, hypertension, and a drug rash, but all was manageable. And these patients are largely have recovered from these experiences and are doing well. We expect in about 2 years to have the final report. And so overall, it's been a very positive experience for our patients. Our goal statistically is to build on an efficacy that we expect without this aggressive approach of about a 50-60% success rate at 3 years. So we're hoping for a 70 to 80% success rate, meaning durable remissions off therapy.